Awesome. So we are live with the next session, everyone. And this session is around NDHM or as it was known previously, Health Stack. And quick housekeeping before we jump into the session. If you haven't already joined the O.Dev Discord server, you can do so by going to ode.dev/join. And let me quickly walk you guys through the Discord server. So is the screen visible? Yeah. Okay. So on the Discord server, you can you can find channels for all of these different ODEs across account aggregator, and we also have the health stack. We have ONDC, DigiLocker, Digital Sky, and a bunch of others that are coming up. And the idea is that this is a platform not only for developers, but it's essentially for builders. So if you're a builder or you're an enabler, you can look up volunteer opportunities. If you're somebody with legal expertise, you want to find out how builders are thinking about it, you can always drop by. If you have some job openings and you're looking to hire other builders, you can post them here. And yeah, we'll be putting together a bunch of resources, some small glitches. We are looking for moderators. So we have a community of, I think, around 60 odd people, and it's growing. So yeah, do join us, and we look forward to seeing you guys here. We have a bunch of more sessions planned over the next 8 weeks, covering the legal perspective. How do you go about building your information user layer, a very practical approach, both for the health side, so as a health HIU, and also as a on the account aggregator side of things. And I'm sure some of you in the audience are not exactly aware that everyone is now familiar with account aggregator, and I'm sure a bunch of you are here to hear about that. But I've got news for you. There are a bunch of other open digital ecosystems that are out there, right? That India is working on, that iSpread is working on, and Ministry of Health, they've pulled together NDHM, which again is a massive project that has been years in the making. It has a bunch of blocks, but you know what? We have a few experts here on the call who would be better suited to talk about that, give a quick context on NDHM, and how that's going to change the digital health landscape for India. So with that, we've already heard from Dheeraj, and at this stage I don't think Dheeraj needs an intro, but we have a very exciting person joining Dheeraj. We have Vikalp here. So Vikalp, for those you don't know, was one of the architects of the Aarogya Setu app before before we all had it on our phones. Vikalp was out there building it, and he brings massive experience before that as well, where he was the co-founder of Goibibo. And yeah, he definitely has an idea as to how do you build at scale. And in his most recent stint, he's currently running a startup, eka.care, which is again a phenomenal startup in the health space. So why don't we let Dheeraj and Vikalp take over? So over to you guys.
Thank you, Nikhil, and a very good afternoon again. Welcome back for our second panel.
Thanks.
So first of all, thank you, Vikalp, for joining us today, taking the time out for us, and a huge round of emoji spam for Vikalp here. He's the warrior building the Aarogya Setu app, saving millions of lives, if not less. So thank you for that, and I'll definitely grill on Aarogya Setu for how that came about. But before that, I would like to know, understand that you have been in senior tech roles across different verticals, right? So how did you come about the health sector?
Yeah, no. So I think first of all, thank you so much for inviting me, and glad to have been speaking with all of you. I'm a developer, right? You leave everything aside. My heart lies in pushing the code live, when it runs on production containers where there's a live traffic coming in and you get error emails, that's how the heart beats, right? So
Right.
that's how I started my career as well. And did Ibibo Group. I was a initial few who started it, and then we pivoted to travel at Goibibo. During the Goibibo days, we realized that a reliable tech is a very important aspect of any kind of internet product experience, and that's where we started investing our energy a lot. Goibibo became successful. We started off with flights, but then we ended up doing hotels and become the largest hotel aggregator in the country. Merged with another great company, Make My Trip, and post that I spent my 3 years over there. And after that, I thought that it's time for me to do something new. Like there's this, so to say, urge to start something fresh and start something from ground up till the time you have energy. I look old, but I'm not that old. So, so I
You
still
don't, you
have
don't, by the way.
I still have a lot of energy left. So I thought that let me start working on something from ground up. And I've got lots of well wishers at Goibibo Make My Trip as well. They agreed that yes, it's time. And my idea was not to do anything in health. The thought was to build a corporate travel product or something in fintech. The whole this change of view to health happened when we got this opportunity to build Aarogya Setu. This was in March 2020 when we got hit with COVID, and it was a small POC or a project that we were doing internally at Make My Trip Go Ibibo. One of my colleague Rahul Goyal, he came up with this brilliant thought, and then we ended up delivering technology, and somehow everything just fit, and we got exposed to this how big is health and how less has happened on digital health space. And that's when the whole thought turned around. One of the most important aspect of any individual's life is their health. But if we ask a very simple question, that what was your thyroid level, say a year ago, you won't know, and you would not be able to even find out if you have these data available, or if you have done any kind of health test before. And all of us would have done some kind of health test. All of us have some bit of health profile, but it's not available digital. I have a 6 year old, and his immunization records are all over the place, right? If you ask me a question, I will not be able to tell whether my child is protected for a specific disease without like going through bunch of old documents or calling up few doctors. So I think that's when the whole realization happens that there is a need to digitize health related data, and the way the interaction happens between a care seeker and a physician, or a hospital and a care seeker, has to be a lot more digital. And hence the story of eka.care and moving towards health started. Or else I would have been helping you guys travel from one place to the other if not for Aarogya Setu. Yeah.
And that would have been again amazing if since you were going to build it. So how has been the journey so far with eka.care?
See, we started off with this whole core premise that what is our strength? Our strength is we know tech, we know product. I mean, not as much as you guys know, but yeah, still to some extent. So that's our core strength, and we want to build a software that actually solves for medical needs, and not necessarily needs which are just keeping the data, right?
Right.
We looked at a lot of software, and we've thought that okay, the fundamental that we need to start working on is on standardization of medical terms, medical lingos, and building information and knowledge on top of it. uh, knowledge in a very simple term, a knowledge such as if you have dengue, then your platelet counts should reduce. Now,
Right.
a software should know it, right? So that's
Right.
the thought that we started working with as we started. And in last 6 8 months, that's what we are doing. We have created a doctor tool that is medically aware, and this doctor tool is what a lot of physicians are using. We've got more than 300, 1,300 physicians that we've onboarded. They use our tool to generate prescriptions, do teleconsultations, and so on and so forth. We also have now a patient-centric app where the teleconsultation will happen from the doctor tool, but we also give ability to store medical records. And one of the most important medical record today is your vaccination certificate. And so hence we partnered with or we approached Covin as well. We've got fortunately access to the Covin private APIs. So we do a lot of work on booking vaccination slots, on storing vaccination certificates, created some very interesting flows on WhatsApp and so on and so forth. So far, pretty exciting. Our upcoming 2 3 releases will be something that we are looking forward to expose. Where the stuff that I'm asking, I was telling, do you know about what happened to your thyroid over the last 4 5 years? So all of these things you would be able to visualize. So looking forward to providing these kind of experiences to the users and keeping our fingers crossed as any other
No,
startup.
that's really fascinating. Matlab, having a high level and a single view of what your medical history has been, or the ability to find out why is this happening,
Yeah.
right? That's really fascinating. So what kind of challenges do you see while building a platform like eka.care?
See, as I said that we want to build a medically aware software.
Right.
We just don't want to build out a software that can store these columns and rows and then just the data points, right? These data point has to have an information associated with it, which is the medical information. So the biggest problem that we started facing is in health, data is not standardized.
Right.
Or the information that is available today in various places is not standardized, and they have everyone have their own way of representing that data. If you
Right.
look at your medical reports, I mean, like just go back and look at 2 3 medical reports of yours, a same value, a hemoglobin value can be represented in multiple ways, right? There are different units in which it can be represented. Similarly, a cough, when you say COUGH, what does it mean? That information today is not available anywhere. In the sense, people are not keeping data associated with this standard techniques. So that was the first big problem that we started looking at and then started solving for it. So our lots of work go into creating these medical knowledge. So we've got now 6 doctors on board, and these doctors actually are just putting in the theory of medical understanding into the standard terms that we are curating technically. There are many good initiatives that has happened globally, such as SNOMED CT, ICD-10, and we are trying to encompass all of that so that the data that we are collecting is absolutely medically aware, and we can give inferences, or we can at least give a right kind of structure to your data. So that's
Understood.
the big problem. I would say the biggest problem on health. I think in
Right.
finance,
Right.
it's still to an extent things are standard, but
Pretty
yeah,
much standard, yes. Pretty much standard. Well, healthcare, our healthcare system is lagging quite a bit in terms of standardization of data and digitalization of the data, actually.
yeah.
Which, yeah,
And see, digitization of data without standardization does not bring in any
does
value.
Correct.
So
Absolutely right.
then it's basically, it won't create right use. You won't be able to create right use cases.
Right. So you mentioned that eka.care is providing a telemedicine service, right?
Yeah.
So taking this in context, how does information translates into inference or knowledge? In say for an example of interaction between a patient and a doctor on a telemedicine call.
Yeah. So I'll tell you how we basically do it, and that's what we have learned. And might be if there is someone who is even a bigger expert, they can correct me. But how do we do it? Is when there is a consultation happens, and when doctor is actually creating notes, right? These notes of a particular patient is standardized and coded in such a way that there's an entire ontology of the data can be figured out. Just to give you an example, uh, for us, a color of sputum is a code, and that code relates to cough. That cough relates to an infection, and that infection relates to a body, an activity in the body, right? So that's how we are basically going deep into codifying whatever data we are generating. So if you are a doctor and I'm a patient, and I come in and say that, okay, I have an abdominal pain, and when you start asking me question, the recording of that data that happens in the software will be absolutely codified, so that tomorrow, when a doctor is looking for more information about this patient, he can actually go deeper into the medical knowledge. Same happens for drugs as well. For us, it's not Dolo 650, and I'm saying Dolo 650 because all of us know about Dolo 650. It is basically paracetamol, acetaminophen, which is a generic, and then that generic, what is its composition? And not only that, every drug has a class associated with it. So, what is the action class of this generic? Because there are, I mean, I'm going a little deeper into stuff, but these action
This is
classes are
fascinating.
important because you should not prescribe a specific action class with the other if they are contraindicative to each other. And to do all of that, you need to have that entire structure. And for us, that's very, very important. So when a drug is prescribed, similarly when a lab is prescribed by a doctor, we know that that lab is basically a hemoglobin, which is blood, and then it associates with so many diagnoses and so on and so forth. So that's how we basically are building software and doing the standardization. But I think we are still learning. I'm as I said, travel I know a lot. Health is such a deep topic. We are still learning.
Agreed. Health is surely a very deep topic, and even you going to the level of connecting dots between hemoglobin and the medicine is definitely going to be very fascinating and really
It's exciting.
mind-boggling stuff.
Yeah, exciting it is.
Yep. So my next question would be on how to implement such a system on scale from a technology perspective, and what are the three things you should be or a builder should be mindful when building such a platform.
See, so one is a very generic answers. Whenever I basically think of building for scale, now I'm going a little bit on tech and not necessarily on health and medical domain. I always, that's my philosophy, to make it really simple, right? Whatever you are, the service that you are building, and that was the philosophy when we did Aarogya Setu as well. There should not be like many services interacting with each other in a mesh. Over a period of time, when you need that kind of a ability, you would end up doing it. But when you are designing it, try to design it as simple as possible. So when we design any kind of a system that needs to handle scale, we try to reduce the failure points as much as possible, and put in a failure point only if it is absolutely necessary, right? So that's the general philosophy, and maybe the point number one, where we always invest our energy. Keep it really simple. Sometime a very simple application that is just doing a MySQL write, and then there is a web service on top of it. It seems like, what is it that you have done? But that is the beauty. I mean, it will handle scale because you have not done so much of complex stuff over there. But understand deeply about what you are doing, right? You cannot create a table without indexes and so on and so forth. So that is point number one. Point number two, when it comes to health as a setup, and when we started, we never actually realized that health will be so complex. I was so optimistic कि यार ये तो कर ही देंगे. But eventually, when the rubber hits the road, you realize that okay, the complexity is far more. So what we said is, there is this whole knowledge, and then there is the delivery of this knowledge, and the knowledge is complex in terms of creating the knowledge, and also determining or understanding from that knowledge. So we kept it as a pure backend, where so we store our data. We have services layer where the data is getting generated. This data again then goes to a fire server, and the fire server is not the first port of call where everything is getting inserted. The inserts of the data happens on our services layer, because there is a lot of complexity that fire as a server and as a service brings in. And for others, fire is like a way in which a medical data is structured. It's a schema in which globally people store medical data. So that actually gave us an ability that you can innovate on your services layer, while you are ensuring that there is a structure to the data as well. So that's specific to medical, where we have created like an abstraction on top of fire, which is our services layer. And I mean, last but not the least, what we've realized, when you are building any kind of software at scale, and specifically when we built Aarogya Setu at scale, uh, the thing that you miss out is on the way you end up securing your stuff, right? And health data is pretty sensitive. Health data is private. I don't want my health data to be shared with anybody and all. So when you think of building services that are private enough, right? Automatically there is a sense of right kind of a scale brings in. I mean, it looks a little counterintuitive right now, but one of the things that happened when we built Aarogya Setu was, we ensured that the private information is actually not transmitted, or a publicly identifiable information should not be transmitted, right? How would you solve it? You have to create IDs, anonymized IDs. How would you distribute all of these IDs, right? You will create 1 billion or 2 billion IDs, and then these IDs will actually be sent to the client. And when you do all that, right, when you create that privacy led architecture, you would see that you inherently are solving for scale as well. So that would be my 3 points, and last two would be specifically on health. But yeah, the first one is the most important, I would say. Simple, absolutely simple is the better.
Very, very, very rightly said, Vikalp. So you mentioned security and privacy. Right?
Yeah.
So implementing an application like Aarogya Setu, or designing an platform like Aarogya Setu, security and privacy are a must for sure. But
Yeah.
then there are societal challenges where people look at it in a different way, that this is a privacy invading or a tracking service like a thing, right? You just debunked the myth that no private information is getting over the wire. But how do a platform, or we as a community building around healthcare system, deal with such technique, deal with this in a technical way, or in a to have the society accept all of this?
Yeah. See, we look at privacy and security a little more. Like if we go a little more backwards, why private and why secure? Uh, because of the lack of trust, right?
Right.
If there is a trust, if I trust Dheeraj with my private data, I would basically give it to you because I know I trust you. There's nothing called privacy and security that you have come in and talked about, right? So the inherent problem today is the lack of trust, and lack of trust is at scale. And a lot of the sort of uh, gossips or non-relevant news around privacy and security also in case of Aarogya Setu was because of lack of trust. So you can't solve for it. How do you solve for it technically? Is by actually writing a piece of technology where you actually are creating a product that is inducing trust. For example, end-to-end encryption, right? End-to-end encryption is a technology that induces trust because it actually enables or tells you that even I can't listen to whatever is happening,
Listen.
right? Exactly, that is what we've done in case of Aarogya Setu as well. That was offline storage. None of the data of your contacts that are being traced will be sent or will be on the wire unless and until you specifically say that, or you are a COVID positive, which is laid out on privacy policy as well and all. So, and that tech is available today. Mobile devices are fat, right? These are fat clients. You can store large amount of data there. You can actually, which cannot be read. You can anonymize it. You can encrypt it. So a similar stuff is what we believe is required and for health as well, and that's what we are also doing at eka.care. We would basically allow you to keep your records, which are encrypted locally, right? The private key is encrypting data on your device, which is not available even to the server. But you can actually do as much, right? Now this technology, be it WhatsApp doing end-to-end encryption, but still people will say that okay, WhatsApp would be able to read messages on their servers. But if the technology stands true, they can't. Same was in case of Aarogya Setu, when a lot of people have uh, like re-engineered the app or like taken out the app. Everyone understood that the data is stored locally unless you are COVID positive or you explicitly say that send my data to the servers. But still, there was lots of mayhem around
Right,
uh,
right, right.
my contacts and all of that.
Right.
And that is what we would do at eka as well. Eka Care will ensure that there is a technology that is driving that trust. But I still feel that there will be some noise around that as well over a period of time.
Sure. And I'm pretty sure. The I think we have to try and have the layman understand this in a simpler manner,
Yeah,
because not everybody is technical. Not everybody understands technicals.
yeah.
Yeah.
And it happens over a period of time. If a brand actually delivers on the promise consistently to a user, then the user trusts. And for us, trust is very important, and that is what we have learned also in at Goibibo. Trust of your users is the most important aspect. If you don't have trust, then you can't build a business.
Right. Now, next, I would like to point out another issue that is from the perspective of reachability and accessibility. So, can you talk about your views on making the connected healthcare ecosystem to reach the Bharat segment?
This is my favorite topic, by the way, and I'll give you an example. What we did is one of the like stuff that I keep telling people is today if you go to and so as we say Bharat, right? And I'll take an example of a town town in Bihar, Madhepura, and Madhepura is a town, is a village. I think 150 kilometers from Patna. They have all kinds of accesses to get entertained by looking at YouTube, or by basically going to TikTok when it was available. So all of that was there, but it's really hard for them to talk to a doctor. Talking to a doctor was a challenge, and they had to go somewhere, right, to talk to a doctor. Leave aside getting themselves tested for any kind of issues. What happened is, we ended up meeting up some very interesting folks from World Vision and Sphere India, and we launched a campaign with Sphere India and World Vision on teleconsultation during COVID time, and it got extended now because of the success. And lots of volunteers have actually, and World Vision and Sphere India had lots of volunteers. These volunteers they've taken eka.care app, and they went into the house, individual houses of people in Madhepura, and then they started connecting them with our doctors, and that resulted in, I mean, a very interesting experience for us, that you can make a big societal impact by actually connecting those rural areas with a doctor. That is so possible with technology. If they can see a YouTube video, they can might as well have a conversation with our doctors. I think by now we would have done more than 1,000 consultations, not only in Madhepura, now that went into other geographies as well. Similarly, during COVID time, we asked some of our friends in Assam to just talk about that we are offering free consultations because we feel that people should connect to the doctors. There are lots of patients and families from remote areas in Assam, because Zubin Garg, who is a celebrity in Assam, spoke about us. They started connecting with our doctors, and you would see on eka.care review as well. Many reviews are from Far East. The names are such.
Interesting.
So that was, we never thought that we would end up solving for this, but as we go along we feel that, oh my god, this is a massive impact creating opportunity, where you can actually allow these people not to go miles to connect to a doctor, and maybe get help whenever they need. So I believe, to sum it up, telemedicine will take accessibility and reachability to a very different level, especially for our country.
Fascinating. That's really fascinating. So I think we are running short of time. So we as we know that NDHM is coming around. So I would like to know what excites you most about from the NDHM perspective,
You
and
see,
what are you and what
yeah.
you're looking forward to.
I think there's it's a beautiful initiative, and NDHM is coming in an absolute right time. The thing is, some of the stuff that India does, especially what we did with UPI and now with NDHM, I think we would create a very different kind of path for the global countries also to follow. NDHM is solving for all the hard problems that we were trying to solve, but we are not. We don't have that wherewithal. A hard problem of how a patient record will reach a patient in a digital format. It's a hard problem, very hard problem. NDHM is solving for that. So we are banking on them. Standardizing and at a national level of this health data is again a hard problem, and we are trying, and NDHM is solving it. So the good thing is, and that's what we are super excited about. All the hard problems NDHM is solving on the health side, and we have to just create the right user interfaces so that we can bring that value to people like myself and all of us. So we will ride. We would want to ride on NDHM.
Awesome. So thank
Yeah,
you, Vikalp.
Dheeraj, we have a few questions from the audience.
Yes. Let's
Vikalp,
go
you
on
have a
this.
minute, right?
Yeah.
Yeah. So first off, let's get Rajat. Uh, Rajat, are you there?
Yeah, can you hear me?
Yeah, we can hear you. Go ahead.
Yeah. So,
Hey, Rajat.
uh, so hi Vikalp. Like I have been following Eka since a long time now. Like
Oh
since you
wow.
launched, yeah. So I wanted to understand, like when we say a word like connected care. So connected care, you mean like you are connecting every stakeholder in the healthcare ecosystem. But
Right.
as a company, how do you focus? Like, do you focus on doctor side, provider side, or patient side? Like, because for any company, there has to be a focus. Now, like, what is the metric? What is the like number of? Is it number of users? Is it number of health records? Is it number of doctors? So, how do
Yeah.
you see? And second question would be around NDHM because you have worked so closely with the government. Like a company like yours is betting big on the success of NDHM. So and I assume like it's about to roll out. Like NDHM is not roll out till now. So how do we see like obviously it's a huge risk and as an entrepreneur everybody takes risk. But the thing is like how do we see like it the analogy of NDHM with UPI or the all the transformation in the fintech industry can't be very linear because healthcare will take its own time. So
Yeah.
wanted to understand these two things.
No, super valid questions, and I was about to tell Nikhil and Dheeraj that no tough questions to me, all tough questions to them. But let me take this one. So to answer your first question, Rajat, I think we are healthcare provider first. You cannot basically build a software, and that's what we've realized without a provider story on health, because your health journey as a individual is more or less at the mercy of the provider, right? You won't
Yeah.
take decisions. Your healthcare providers take decisions and you follow those decisions, right? And which is right as well, because you don't know about your body and you don't know about your anatomy. And the most important constituent there is the doctor. So for us, doctors definitely are the most important constituent for the ecosystem, and we will build for them and we will continue to build for them. And we consider them as the main sort of so to say the fulcrum where everything will revolve around. So that is about eka. That's why we've invested quite a lot of energy on building a doctor tool that is nice. I would say you should try it has got stuff that we feel would be valuable and can create a nice experience. To answer your second question, you are right. UPI and NDHM, you cannot do an apples to apples. And I don't want, there is a complexity that fintech brings in, but there is a lot of complexity that health brings in. Health is, and specifically the number of sheer data dimensions and matrices that health has is at least 100x of that of a fintech sort of a play. But why we are banking big on that is uh, this has to happen. Everywhere else it has happened, and this has to happen. And government has taken a very bold positioning over here. And look at the way it happened in the US. US took an approach of stick, right? A stick in the sense, I am the payer, and I'm gonna pay you only and only if you put all the records in an EHR, which is ICD-10 coded. Now, as a physician or as a lab, I have to follow that norm, because or else I won't get paid, right? India is taking a very different position where they are saying that we would do a hard work of standardizing. We would actually make sure that there is a way in which the digital players will enable providers to create that data, which is hard. But if it is successful, it is far more scalable. So to sum it up, Rajat, it has to happen, the digitization. And the biggest initiative today for our country is NDHM. So we are banking big on this. It'll take time. Yes, it will definitely take time. It won't happen overnight. And it might take a lot more time than UPI. It might take a lot less time. I'm a overly optimist person. If it takes less time, it's good for the ecosystem and all of us. But whatever it is, as an organization, we will continue to invest our energy there.
Thanks a lot, Vikal.
Yeah,
Thank
thanks a
you.
lot, Rajat, for asking that question. And to add to that, uh, you said you are building around NDHM. So, what are the opportunities for all the builders that have tuned in today that should explore around NDHM and how they can collaborate with you?
Yeah. See, I think there is a good opportunity to, and that will help NDHM as well and ecosystem as well, to build softwares for providers that are not only NDHM compliant but are also standardized, right? And that can only happen if there are these digital tools that physicians or labs or many other healthcare providers use. So that is one area where I feel that technologists, software engineers, entrepreneurs should invest. Uh, on the other side, there's a huge opportunity in creating a PHR app, like an app that actually holds your records and so on and so forth. So that's also an area where one should invest on. So there are, and all of these specific will have its own subcategories. But it would be a good idea for people who are doing stuff on health to actually go really deep into NDHM and understand the core philosophies. I think it's well laid out.
Awesome.
Yeah,
All right.
and we have one last question. That's what is the incentive for private practitioners to really get on the NDHM bandwagon without government intervention, without the stick that you mentioned, Vikalp, that was seen in the US, for example?
Yeah. See, the thing is, what was the incentive? If I ask the same question, like 5 6 years ago, what was the incentive for banks to do UPI?
Right. Yeah, it's going to be, I think, eventually the market competition and those dynamics will play out.
See, what happens is, incentive driven product or any experience would not last long, right? UPI inherently was a need, right? Was a need for from user perspective, from business perspective. There will be actors in between. They would not realize at the first instance that, okay, what it would entail and how it will give me a short term benefit. But if you look at a long term view of NDHM or any kind of standardization of health records, what a healthcare provider care for, eventually, if I am a good healthcare provider, I want to give a better health outcome to my patient, right? Or else he will not come back to me. If Nikhil comes to Dr. Vikalp and Dr. Vikalp give him a medicine that doesn't solve him, then Nikhil won't come back to me. And that everyone understands, right? And I can actually solve Nikhil's problem much better if I know a lot more about Nikhil. If I know what's the age of Nikhil, I can actually give a much better advice. Then, if I know if there are any previous medical conditions of Nikhil, I can get the health outcome even better. So, if you look at the long term value, that is immense. And I think that is what will eventually drive the scale and movement of the ecosystem. There will be initial push, and that will be the incentivization. But I won't hinge a lot on just keep on thinking that what's the incentive and how would we, uh, if there is no incentive, then this won't scale. If there is no incentive, the only thing is it will take time, but it definitely would scale.
Right. The problem is simply just too pressing, and
Yeah.
ultimately, if it's like insurance, where claims is the moment of truth. and for doctors similarly, it's ultimately the health outcome. We've heard from a bunch of doctors also, where medical history plays such a critical role in diagnosing. And yeah, I'm sure the medical fraternity is looking forward to companies like eka.care and other health service providers to help them out and provide the abstraction so that they can still continue to do their job spectacularly.
Yeah,
So
no, looking forward. Yeah.
so with that, thank you, Vikalp. Thank you, Dheeraj.
Thank you so
We
much.
had
Thank you.
Thanks a lot. It was good fun. I hope I was of some value, and best of luck.
Thank you for all the insightful answers. Thank you.
thanks.
Bye
Thank you,
bye.
guys. We'll be back in a few minutes.
Thank you.